my name is Shelly Anderson. I'm going to be working with Stephanie McDole and Thompson, and we're going to be talking about occupational therapy. So first off, what is occupational therapy? So it's a profession that helps improve the quality of life for people of all ages. So it especially focuses on people's ADLs, but Stephanie will be talking later on more about this. So they work with people who have physical, mental, developmental, social, and emotional problems. So occupational therapists really help adapt the environment to fit each individual patient's needs. So they customize interventions to help improve the daily performance and to reach each person's individual goals. So next we're going to be talking about the educational background. So there are a vast majority of majors that one can focus on in undergraduate in order to apply to occupational therapy school. But the most common are kinesiology, biology, human development, and psychology. So most applicants are required to have around 40 hours of experience in more than one setting before applying. And also the prerequisite class requirements that are mostly required for occupational therapy schools are chemistry, human anatomy and physiology, statistics, psychology, and then each individual program also has additional prerequisite requirement classes. Some programs require a bachelor's degree, and this is typically your more traditional route to get into occupational therapy school. But some programs like Augusta University here only require 90 hours of prerequisites to apply. So the professional training that OTs are required to have are 6 semesters, and the typical coursework that an occupational therapy program has is in biological and behavioral sciences, specialty courses in occupational therapy skills, the general anatomy with focus on nervous system, and physiology, movement therapy, and activity adaptations. So there's also 24 weeks of field work that are required. So since we're here in Augusta, the Augusta University program requires 6 one-week rotations and 2 long 12-week rotations. So in these fieldwork rotations, there are a variety of different settings that are required, such as an outpatient, inpatient, home health, and nursing home. So they're also required to work with a variety of different clients of all ages and conditions to get as much experience as possible. So as far as the licensure is for occupational therapists, is most states require a license, and including here in Georgia. So in order to get a license, they have to complete an OT accredited program. They have to get the 24-hour field work that I've discussed previously, and they have to pass the OT board certification exam. So also, there are voluntary certifications that are available, such as in gerontology, pediatrics, environmental modifications, and physical rehabilitation. So all states do require a national registration that has a 3-year renewal process. So in order to renew this registration, continuing education courses are required to have. So CPR or basic cardiac life support are also certifications that occupational therapists can have.
Hi, I'm Stephanie McDole, and I'm going to be talking about the required skills for an OT. So the first one is having communication skills, both spoken and written. So it's necessary to be able to communicate with your patient on their plan of care in the clinic and in their instructions at home at a level that they can comprehend. And then it's also important that you can speak and write in a way that will be effective in communicating with your colleagues to pass along pertinent information about the patient as accurately as possible. Another important skill is being sociable. So you need to have good interpersonal skills for the patient to be able to trust you in your interventions that you're giving to them. And then also to not only increase their compliance in that aspect, but also to help you figure out history and background information about them that'll help with your clinical decision making. Another thing is being creative and adaptable in problem solving. So since OTs are guiding patients through interventions that aid in their ADLs and IADLs, they have to be able to get creative in simulating the patient's range of environments, like in the home, workplace, and school. So they have to do what they can in a clinical setting to simulate a non-clinical setting. So focusing not only on strength training and range of motion, but more specifically the activity that they're required assistance in. And lastly, they need to be patient and compassionate. So like pretty much all healthcare workers, this is an important characteristic to have just because we're in a field of making people feel better. So the patients that you'll be working with are in a state of vulnerability, so having a positive attitude will help you help the patient in their physical and emotional recovery. And lastly, Lauren Perkins, one of the OTs that we interviewed, summarized this pretty much, jack of all trades but masters of none. So there's so much that an OT covers. It's important to be flexible and always on your toes and always wanting to learn new things to do whatever it takes to help your patients. So for duties and responsibilities on the OT, in the workplace, pretty much their daily activities are similar to PTs. They'll evaluate, design treatment plan, educate patient and families, consult with related staff, complete documentation, and redesign their interventions based on outcomes. And again, like Shelley and I have both mentioned now, they'll help adapt in a range of work or environments with adaptive equipment. And Ann Johnson, another OT we interviewed, summed it up as an aim to promote independence. So as I have here, two of the exercises that they focus on will pertain to ADLs and IADLs, which are activities of daily living and instrumental activities of daily living. So the 6 basic ADLs are eating, bathing, dressing, toileting, transferring, and continence. And instrumental activities of daily livings are not essential for fundamental functioning, but still pertinent to independent living. So like meal prep or going grocery shopping. So if you think about all the things that go into an activity of daily living, the specific exercises, you really have to focus on a range of things. So like functional mobility, body awareness, vestibular integration, dynamic standing balance, visual motor integration, bilateral integration, and a range of cognitive skills such as sequencing, so like being able to adapt to what is around you. And some So OT and PT interactions are important when you're making a plan of care for a patient that requires a lot of things. So Ann Johnson summarized this pretty well. An OT will typically cover fine motor and upper extremity, visual motor, perceptual motor, sensory, self-help issues, while PT will cover gross motor skills and ambulation. So an example of a couple of these things would be in acute care, a PT might focus on walking and safe gait, whereas an OT will work on visual awareness, spatial orientation, or other cognitive skills as appropriate. So in this aspect, a PT might work on lower extremity neuromuscular re-ed and strengthening, whereas an OT might work on preparing you for external stimuli and being able to like do other things while you're walking. In a NICU, a PT might work on musculoskeletal alignment through weight shifting. So like if they're in a wheelchair or trying to get out of bed, they'll strengthen your core, lower extremity, and upper extremity in order to shift your weight and promote proper alignment through positioning. Whereas an OT, similar to the first example, could incorporate appropriate sensory stimulation from that positioning. So like being able to grasp the rail and push off of that, or like use adaptive equipment. And in a school system, a PT might work with a student on prone prop on one elbow. So it's kind of like if you can visualize putting your elbow on a desk for writing and doing this motion, which is a gross motor skill. And an OT might work on promoting grasp after doing that. So like fine motor skill with precision pinching with a pencil.
Hey, I'm Callie Thompson, and I will be talking about some common issues facing occupational therapy, and then if there is direct access in the state of Georgia for OTs. So after interviewing our 3 occupational therapists, when we asked them the question of what are some current issues facing occupational therapy profession and organization as a whole, we found that there was a common answer that there's kind of just a general lack of public knowledge about what occupational therapy truly does. For example, Lauren Perkins stated that there's the perception that OTs do more small muscle things while PTs do large muscle things. But as Stephanie mentioned, you do need your strong core muscles, which are very large muscles, in order to help you be stable enough to sit upright in a chair while you work on small handwriting muscles. So Lauren wishes that that perception wasn't believed by the entire public. And she also disagrees with the idea that PTs do more lower extremity while OTs do more upper extremity, because as we as students know that we're taught to teach or to treat a patient in a holistic approach and treat them as a whole person and not just focus on one leg or one half of the body. So she wishes that there wasn't necessarily that perception, because we do all want to take the holistic approach in order to provide the best plan of care for our patients. And then Kim Benjamin stated that there are also people in the public who take occupational therapy almost too literally and think that occupational therapists are therapists who are, their job is just to help them get an occupation. And that's not true. She wishes that people knew that their job isn't to help you go into the workforce and work, but their job is more to help you overcome deficits that you may have so that you can perform your ADLs and you can go out to the workforce and get a job. And also, Lauren mentioned that she thinks that OTs are behind in research compared to other professions, and she believes that this could just be because there are not as many OTs out in the workforce as there are PTs, for example. And so because they have a smaller group, then they don't have as many people conducting research and able to find new things. So in regards to direct access, when we asked the OTs if there was direct access for them in Georgia, they all clearly stated that there is not direct access, and they all voiced the desires that they wish they had direct access like physical therapists do, because they think that that's the best way to reach out to the population and be able to treat them without having to wait for a physician's referral. They did tell us that in some states there currently is direct access granted to them, and so they're hoping that because of that, it's only a matter of time before direct access is granted in Georgia. And Kim Benjamin is a physical therapist in a school setting, and so she did tell us about how in a school you do not necessarily have to have a physician's referral to receive school-based occupational therapy services, and that's because there are laws in the state of Georgia that require schools to provide services to students as necessary in order to help all the students kind of be on a level playing field and receive the services that they need in order to perform the best in the school setting as they can. So in conclusion, as physical therapists, we will most likely be working closely with occupational therapists at some point in our career. So it's important that we develop close relationships with them and really understand their focus while they understand our focus, but realize that there is kind of an overlap, and it's important for us to work together in order to provide the best plan of care for our patients. And we also need to encourage OTs as they go through this process of trying to gain direct access and trying to get their profession more well known in the public. We need to encourage them since we as PTs just went through that same process. So thank you for listening to our presentation, and have a